to keep us moving, and I'm going to introduce our next speaker, who is Justin Gleeson. So Justin is the clinical midwife specialist in addiction for the HSE, and he's linked with the Rotunda Hospital. And Justin is going to talk to us about his experience as a member of the interagency steering group and how the service he works in works along the infant parent support project. So welcome, Justin, over to you.
Thank you, Laura. As Laura said, with Justin Gleeson is my name. I am the clinical midwife specialist for the HSE addiction service, and I've been working in this role really since 2007. Prior to that, I was a nurse in Galway back in when I moved to training in the 90s, and I worked as a midwife in the Rotunda for 7 years prior to changing over to the addiction service, to say. Well, the core part really of my job really is to case manage all substance misusing women who really attend the maternity services at the Rotunda Hospital. We offer, our clinic is called the Dove Clinic, and we offer a very, very comprehensive, robust service to women with complex needs associated with addiction. We have a very close liaison with the infectious disease department of the Mater Hospital. We also have a medical social worker who works, who normally is our direct link with the Child Family Agency in Rotunda. We also now have a mental health support midwives who work with all of our women now. It's a very, very comprehensive service that has expanded from one consultant psychiatrist and one clinical midwife specialist to now 2 psychiatrists and 11 clinical nurse specialists. And now, as part of our liaison with the NEIC in the Dublin North Inner City, we have case managers who work with some of our clients in relation to accessing the various, I suppose, barriers in relation to homelessness and other addiction services. I suppose a lot of my role really is compacted in dealing with antenatal issues, really from referral really onto trying to achieve the best possible pregnancy outcome, and we focus a lot really on the antenatal care. And over the years, really, it became apparent that there became a massive void in really in postnatal and aftercare services. And I suppose in 2012, I was approached by Ballymun Local Drugs Task Force and Ballymun YAP as well about the development of a role that provided additional supports to women and their babies accessing services in the first 2 to 3 years of life. When Vera took up her position, I mean, back in 2012, we needed really to focus on an appropriate referral pathway. And as alluded to there, as Vera and Mary alluded to there, that pregnancy provides a great incentive for change, in which women with a history of substance misuse often are very receptive to working with supportive services during their pregnancy. Some supportive services during their pregnancy, maybe not all. So I suppose in recognizing this, I mean, like it was really, really important. I think really, Mary was saying to us there, the essence really of Vera's role and my role really is the development of a therapeutic alliance with our clients going forward. And I think so that's why it was really important that that Vera would engage during the pregnancy, so that alliance is there and a trust is there, so that they can build going forward in the 2 to 3 years of that kind of therapeutic alliance. Our roles, I mean, like our relationship between our two services has evolved in the years as addiction has changed, from going from primary opiate addicts, really going from cannabis to benzodiazepines, crack cocaine problem that we have at the moment, and also for women who are currently in methadone maintenance programs. Also as well, I mean, we cover a wide range of issues in relation to homelessness, domestic violence, and child protection issues. Vera's role within Ballymun has certainly for me has improved the services for the women engaged in all addiction issues within the Ballymun area, and she has been, well, I suppose the infant support project is certainly something that I feel that should be replicated in all areas, really, not necessarily throughout Dublin, really, but really throughout the rest of the country. And it's something that I certainly would be advocating, and it's been highlighted really in the national drug strategy. So.